Hello, we're here with another edition of Chamber Chatter, and today we have a very special guest on, and I think the whole community will enjoy this presentation. We have with us Christian Lanphere, who is the administrator at Cambridge Health Alliance Everett, formerly the Whidden Hospital, and they have some wonderful plans in store for the Everett community and people from surrounding communities too, excuse me. But I think you will enjoy his presentation. By the way, I am Rosemary Hughes and co-host Carol Churchill, and we're going to get right to our guest today. Christian?
Thank you for having me.
Thanks for being here.
So, what I would like to say, I'm relatively new into the role of at the Everett Hospital. I've been with Cambridge Health Alliance for about 12 years in serving in different roles. And, I think it's, for the community, we've taken a new name on. It used to be the Whidden Hospital. And I would tell you that Georgia Whidden was the founder. She actually gave over her land to build a 14-bed hospital. So that's really how Whidden really became. And over the years, her deed that she left was really to serve a population that was less than fortunate, had very minimal means, and this was her goal, was to always have a hospital at the top of the hill that was catered to those who didn't have the resources for healthcare. So, the Whidden Hospital has gone through various changes over the years. The Cambridge Health Alliance, we picked it up in 2001. And over the course of the years, we've been trying to ingrain ourselves further into the community. So in October, we changed the names, formally changed the hospital's name from the Whidden Memorial Hospital to the CHA Everett Hospital. And we did that for several reasons. One is to demonstrate that we are a community hospital, that our mission and our goal is to further build our roots not only into the community of Everett, but also into the surrounding communities. But also it really reflects our other facilities. So we have the Cambridge Hospital in Cambridge, we have the Somerville Hospital in Somerville, and the Everett Hospital in Everett. And that was really sort of the idea behind the name change, was for many of our patients or guests who came up to the emergency department their first time, they didn't really know that Whidden Hospital was actually part of the Cambridge Health Alliance. So that's really sort of the reason why we added the name to the hospital. And so I think if you get the opportunity to come up to the hospital, I think you'll sort of really see a lot of the improvements that the organization has made to the hospital. Namely our emergency department, which is it's the 6th busiest emergency department in Massachusetts now. Yeah. We initially, the emergency department was like a 15, 20-bed emergency department. And it was a very small space. It was really designed to meet about 15 to 18,000 patients a year. When we built the brand new emergency department and it opened up in 2008, that was designed to meet a patient visit of about 24,000 patients. And now, this year, we're getting ready. We're getting pretty close to hitting the 50,000 patient visit mark. So, the hospital it's very busy. We've changed some of our processes internally to make it a much more patient-centered program, so that when the patients come through our system, they have a better experience. Not only when they come through the emergency department, but getting their services when they go up to the various medical surge floors, interacting with their healthcare team, and then interacting with all the ancillary services that the hospital provides.
Now, Christian, when we were talking just a little while ago beforehand, you had mentioned that the Everett Hospital is a safety net hospital. What do you mean by that?
So the hospital itself is part of the Cambridge Health Alliance system, so healthcare system, and the healthcare system as a whole is what we call a safety net hospital system. So there's 8 of them in Massachusetts, and really what a safety net hospital is, we are focused and centered on really meeting the needs of a patient population who has less means, has limited, maybe they're uninsured, they're on some type of government subsidy program, They are in complex type care programs where we're following them essentially from their initial visit, and we're following them all the way through our primary care system and getting them into programs, also enrolling them in our behavioral health system, so that we become more of a patient-centered medical home, where many of our patients, I think in many institutions, and I think it's sort of the change in healthcare, that you're constantly being given appointments to see different providers, and you constantly have to keep coming back and forth to visit. The idea is by bringing them in once, they can get it's a patient-centered medical home type model that we've now created, where the patient now comes for one visit, and we get them through the various specialists.
So multiple services in one
Multiple
facility.
services in one visit, but as a safety net hospital, we're really centered around a population that maybe does not have insurance or it has very limited means, and we're there to pick those folks up and help ensure that they get not only a high level and high quality of care, but also to see them through the system.
And do you have people on staff that speak languages other than English?
We do.
Okay.
So one of the things that Cambridge Health Alliance, many of our patients don't, English is not their primary language.
Right.
They come from a wide variety. Most of our patient population speaks either Haitian Creole, Portuguese, Spanish, and then English is the fourth. So we have interpreters 24 hours a day at all of our campuses and in our health clinics who can come in and interpret. We do, as a policy of Cambridge Health Alliance, we don't want family to do the interpreting. We want to use our interpreters so that the patient gets the exact information concretely. If the patient doesn't understand something, this is an opportunity for them to interact with their healthcare team. Sometimes family members may be reluctant to say something in front of their other family members, and this really creates that patient-physician relationship much better. Now, if we have patients who don't speak one of those languages, we also have another mechanism where we have the ability to reach out to 65 other languages through the use of a telephone. So it's a telephone program, but we like to do we want our folks to be doing the interpreting so that we know that it's concrete. They've gone through all the various licensing tests and have been certified to actually do medical interpreting.
Plus, some patients might not want a family member to know certain things.
Many of them don't. Yeah, many of our patients are, they're
sensitive.
They're very
One reason or
reluctant. Even for our behavioral health patients, this is there's already a stigma attached to mental health, and so I think for many of these folks, regardless of maybe what their culture's like, it may not be a positive thing. So they're much more reluctant with family, and so by having our interpreters available, they're on site as well as we have them by video conference. The patient is getting a truly accurate communication of exactly what their healthcare team is trying to convey to them.
Now, what other services do you offer as far as a person doesn't feel good, they have the flu, they have pneumonia, they have something like that? What do you do for inpatient? What kind of services?
We're a community hospital system, first and foremost. So we have, any patient who starts most of our patients will start into the emergency department, where we have board-certified emergency physicians who will see the patient, evaluate the patient, depending on what their chief complaint is. We have, we're a well-known system for psychiatry. We have all specialty services available: neurology, infectious disease, orthopedics, general surgery, endoscopy. I mean, we have many of the major services that most healthcare systems provide. So within our community hospital itself, we have a very large emergency department. We have 2 med-surg units, both with telemetry capability. So we're able to monitor their heart or any of their cardiac conditions while they're at the bedside, and we can see it at a central monitoring station. We have a adult psychiatric unit, and then a geriatric psychiatric unit as well. And then we have a intensive care unit. In addition to those services, we have inpatient rehab and outpatient rehab in the hospital. We have medical specialties where we have specialists from oncology, dermatology, to surgical capability, ENT, ear, nose, and throat. We have general surgery, orthopedics. So a lot of those services are available right on site inside the hospital.
Now, how many people work in the hospital?
So we have about 900 employees
Wow.
that work actually in the community hospital. And
That's just in Everett?
That's just in Everett.
Wow.
And
That's a lot.
we will always, if a patient requires a level of care that we either do not provide, or that level of care is much more complex than that we can safely provide, we will always transfer the patient out. We do not keep patients in our hospital if we feel that they are not safe. If they are not safe, we will transfer them out. We have an affiliation with the Beth Israel Deaconess Medical Center, so many of our patients will be transferred over to the BI for higher level of care. And for children, because the Beth Israel Deaconess Medical Center does not see children under the age of 14, we will transfer those patients to the Mass General.
Okay.
So the idea here is that within our system now, we have the ability not only to bring experts in, but also to have us transfer those patients to the experts. And in our communities now, the major healthcare systems are moving in with the Beth Israel Deaconess program in Chelsea. Their patients, instead of being able to have to go into Boston for care, they can come right to us. And our physicians and the BI physicians can both get access to the records now. So we use the same electronic medical record systems now. So just the technology, I think, over the years has just vastly improved. And now this is becoming more and more of a patient-centered environment where the patient really is the core, and then the team really surrounds that patient's care. And so each day now, on an inpatient system, all the docs as a whole, all of them get together every morning, and they go through each and every single patient. And I'll tell you, we had someone come in, and who was observing. And to tell you the level of detail that we are now going through with our patient population, particularly our elderly patients, we now want to know exactly what the home is like. So a good example of that is for patients with COPD. Do they live on the 3rd floor? How many steps does it take to get up? We can sort of help them manage the disease a little bit, but if we call an ambulance and get them upstairs, but they can't get downstairs to do their daily activities, or they can't even get food, we're doing them a huge disservice. So for even in what we call MDR rounds, the team as a whole, with case management, social workers, nursing, and physicians, they collectively as a group want to know what the home like, what type of support mechanisms are available to the patient, who will be checking in on the patient, does the patient have need additional services that are needed, whether it's VNA or it's a home meals type program, so they're being fed, so that we can get them out of the hospital system, try to keep them out of the nursing homes, and keep them more in their own private homes.
So
and that's really our goal.
You help them with the resources that they need, or where to get them and where to look
So
for them.
we
and,
want to set them up with the resources before they leave the hospital, so that
So
when
you
they
have
go
the connections to
when
all
they
the
go home, and that's
service.
really our case management team is led by Becky Sweeney. They're just phenomenal. We are very much, folks are like, well, that's a little intrusive, but for us, we want to know exactly what the home life is like, because we want to reduce their risk of falls. We want to make sure that if they have breathing trouble, if they have to climb 3 stairs or 3 sets of stairs to get to a 3rd floor, that may be too much for them, and maybe we can help them look at something different. So we look at what accommodations we can make, but also if it's medical med management, making sure that they can take their medications in a responsible manner, that there's someone there to help them. So we do connect them with services where it's appropriate. And we work with the various insurance companies to get these programs set up. So the patient, most of these, they're not feeling well, they're sort of lost, they don't know what to do. we're there really to help sort of bring them together and
And they know that
and
they
connect those
can,
services.
call you if they have a problem.
So
and
the-
once
or
you've
they
taken care
well
of
the,
them.
the goal is that we want them to be able to reach out back out to us.
Yeah.
We want them. We also want to keep their primary care doctor or their specialty doctors in the loop about exactly what's going on with their patient's care, so that their primary care doctor will now get heads up on the services that are being provided, so that when they start checking in with their provider, then their provider will have a good understanding of what the hospital level of care was like.
Now, you are a neighborhood hospital.
We are.
And so you are surrounded by families, neighbors, everybody. And also sometimes a lot of the problems of the local communities come to your door, right? And that's another thing that, I don't know, with the opioid crisis that's going on everywhere today and all that. I mean, how do you deal with that?
So I would say that there are two very significant events that I think we have seen over the years. Obviously, we are no different than any other community in Massachusetts and for many parts of this country struggling with the opioid epidemic. It's troubling, it's concerning. The number of youngsters now that are affected by this continues to increase. Folks who've been, and they're already stigmatized. It is a disease. We are, we're trying to be of service to them, help get them into programs. A lot of these programs have been cut. We need to look to our elected officials to help restore some of these support mechanisms to get folks help. But also on the mental health side, a lot of those services have been cut. And so for many of these folks and many of our patients who, they want to do the right thing, sometimes it's financially they can't afford their medications, or they stop taking their medications for whatever reason, and now they're in some type of crisis. So we get those patients, and the goal is really to get them to where they really need to be, and that's into a hospital system, and not into the criminal justice system. So the goal is really to get them up into an emergency department, to have them evaluated by the experts. They'll be evaluated by a behavioral health specialist, and then they'll be followed up with a medical doctor and evaluated. And then we sort of, as a team, they collectively decide what we're going to do best for the patient. But I will tell you that, the Everett Hospital, I think the staff in the emergency department in particular are very experienced, not only working with this population, but also working with patients who have been struggling with some type of addiction, whether it's alcoholism, it is opioids, or some other type of street medications. One of the things that I feel very fortunate about is that now our chief of emergency medicine for the hospital, she's also a toxicologist, and so we get the double benefit from her expertise in being able to not only identify the changes that are going on. A lot of these cases that keep coming into the emergency department are no longer just straight heroin type cases. These are now being laced with fentanyl. These are being laced with a number of other products that we're not always sure of what they are. And so a lot of times for us, it's really, we have to take that step back to really evaluate what other things are in that person's system. By giving them medications to help, could we be making the situation worse? And that is really where the detective work is really coming in, because we don't know who they are or what they've been taking. And so we really have to be very, very careful about how we manage this patient population, but also trying to get them, once we get them, we can safely save their life. It's then the continuum of how do we keep them from continuing to abuse. And I think every hospital is struggling with this.
Right.
We are all, every socioeconomic group is affected by this, regardless of your age, gender, race. Every group across the board is being affected by the opioid crisis, and we're trying to stay on top of it. Our providers are also being much more careful about in taking the lead with other state representatives and trying to curb the excessive prescription use of opioids is also one mechanism. Another mechanism we're also taking is trying to get them into treatment programs to help them stay clean.
Now, you work with the local police departments on this too, isn't there?
We do.
The HUB program?
So the hub project in Chelsea has really become they've become the national, they've getting a lot of national attention for their program. And Everett is looking at unveiling a similar program along with some of the other surrounding communities.
Now, what is the HUB program?
So the HUB project is a grant-funded program that is really sponsored out of the Chelsea Police Department. And what they do is they start coming together. They bring a lot of nonprofits together, and we are now at the table. Although we have to be careful, we have some restrictions by regulations. We do need to protect our patients' privacy, and we do that at all costs. So the idea, though, is bringing all of our partners together through the police department, and to stop arresting folks, really going out with outreachers into the community who are given certain clients to follow, and they check in on them regularly, check to see how they're doing, trying to see if we can get them into some type of sober housing, or trying to get them services, or just checking if they don't want those services, just continuously checking in on them, sitting down and talking with them, trying to see if we can't pull them in and try to get them some services, or when they're already under the influence, it's getting medical attention by getting the ambulances there and then getting them up. And then also their team will reach out to us, so we'll be on the lookout for their client. For those clients who live or reside in Chelsea, we're also now trying to give the patients more information about how they can get help, and that this program does exist. And we are seeing phenomenal improvements from Chelsea. And I'd like to see that this program gets rolled out. But we're at the table. We're at the table with the police department. We're at the table with other nonprofits who are with one goal in mind, is to see if we can help slow this epidemic, or if we can help for those folks who are struggling with the addiction get into some type of program where we can get them clean and sober, and we can get them leading a much more productive life. We can handle their medical issues, but we really need to take the next step with them and see if we can't offer them up other services, so that we can, and then have outreachers in the community really reaching out to them and working with them much more closely. But it allows this dialogue to occur with the whole intent of trying to get folks off of these drugs and trying to get them to lead a much more productive and safe life. And that is really where I think we're seeing a lot of. I will hand it to not only to the city of Chelsea, but to the police department for all the good work that they're doing in this area, because it's definitely, we're starting to see the rewards from them already. So I'm hoping that Everett will also follow suit on this.
This has been great. We could continue this and talk all day long about this, and you are so informative, and you have so many things to tell us, and maybe you can come on in another time again and do something like that. But I think that you've given a great picture of what you do and who you are. I was actually born in the Wooden Hospital.
No kidding.
I won't tell you how many years ago, but I was born there. And I live right in the neighborhood of it. So, you do see a lot of changes and all, and there's very positive feedback coming from when you people took it over, and I think it's great for the community.
It's great.
To know they have it.
I think the Cambridge Health Alliance as a system, there's a reason we're a community hospital. We are here for the community, and we want to dig our roots deeper into the community, and we want to get much more involved in the community as well. And that's sort of what we would like to bring back to the community as well, especially for our neighbors, who live directly around the hospital, who are constantly, having to hear the sirens of the ambulances, the police cars, a lot of the traffic that comes through their neighborhoods. We want to give back in some way.
And
the community as
speaking
well.
of all that, and it just a little side thing, I live right at the foot of the hill, the hospital, so my street is like a thoroughfare.
Sure.
So then the ambulances keep going by, unless they stop on our street, and then we all run out to see what's going on. We're so used to it. When my grandchildren are there, who all live in these little suburban communities, you know, they'll come by and go, Nana, another ambulance, another ambulance. So funny, but you're a busy place. From
We
what I
are.
see, between the police cars and ambulances that go up your street, because I live right on the Everett-Chelsea line,
Sure.
so they're coming constantly.
Yes.
And I can understand why you have the volume that you have.
Well, we're very proud of that, and I think we're very proud as an organization. You know, and the improvements I think you'll see. So definitely come up. I think you'll see some big changes over there. I think it looks good. We've made some, you know, a lot of the work that Deb Murphy did in her role when she was the site administrator for years. We
Yeah.
like to continue on a lot of that.
Absolutely.
And our chief executive officer is very much dedicated to, you know, living and breathing the hospital's mission of working, living, and interacting with the community. So
That's great.
It was very interesting.
Yeah, it is. It is.
So we thank you so much,
Thank you.
Christian, for coming
Yes.
on. And
Thank
like I
you.
said, we hope to see you again on this, and keep up the work that you're doing, your whole staff. I've had some meetings with your groups over the time, and you know, I'm very impressed by everybody who's there.
good. I think, you know, it's a great group. What I would say about the hospital as a whole, you know, it's very generational. You know, a lot of our staff, their parents worked there. Their parents worked there. So it's, you know, a lot of them, it's they're actually, you know, they're residents of Everett. They grew up there. They, you know, this was their hospital. Their family all worked there. And so I think they do take a lot of pride in where they work and continuing to breathe and live the Cambridge Health Alliance mission.
So
it's
you're a
been good.
community organization internally as well as externally.
Absolutely,
Yeah,
absolutely.
yeah,
Yes.
that's good to
definitely.
hear.
Yes, yes.
Well, thanks again
Thank
for
you
coming
very
on
much.
today. We appreciate it.
All right.
And that concludes Chamber Chatter. We thank Christian for being with us today from the Everett Hospital. And I thank my co-host, Rosemary Hughes. Always a delight to be with you.
You too, Carol.
And we hope our viewers enjoyed the show as well. Thank you.